For clinical trial 3 by Grain et al., the dose was 100 milligrams for the first day, followed by 100 milligrams for the next 9 days. The total patients were 237 patients. 158 received remdesivir and 79 received placebo. The patients were measured at the baseline before treatment, during the median follow-up after 14 days, and at the final day after the clinical trial has completed. The results show that among the patients, 103 patients, 65% who received remdesivir, and 45 patients, 58% who received placebo, showed clinical improvement. In terms of time to clinical improvement, it took an average of 21 days and 23 days for patients who received remdesivir and placebo respectively. 61% of remdesivir patients and 58% of placebo patients got discharged. For deaths, there were 15% death and 13% death in respect to remdesivir and placebo.
Clinical Trial 4 by Beagle et al. 2020 called NIAID-ACTT-1. Out of 1,059 patients, 538 patients received remdesivir, while 521 patients received placebo. After 14 days, the treatment group had a shorter recovery time of 11 days, while placebo had 15 days of recovery time. Mortality percentage of the treatment group is 7.1% and 11.9% in placebo. Serious adverse events in the treatment group is 21.1%, while in placebo group is 27%. Recovery of treatment group is 62.1%, while in placebo group is 52.4%. So the conclusion of this clinical trial was remdesivir showed great effect in shortening recovery time, although mortality rate wasn't much different. Hence, the treatment with antiviral drug alone wouldn't be enough.
Comparison of remdesivir with other antiviral drugs. To give you another insight about remdesivir potency, we are providing you with some clinical trials of another antiviral drug that has been used to treat COVID-19 as well, so you can compare it. Firstly, a test was conducted in a total of 237 patients, in which 158 patients received remdesivir via intravenously and 79 patients were given placebo. The results show that there was no significant difference between both of the groups. And even the remdesivir group had a higher adverse effect with a total of 66% patient compared to placebo that had only 64% patient with adverse effect. Other than that, there were 18 patients that stopped early for the medication, while the other group only had 4 patients that stopped their placebo. Meanwhile, in another test with oral favipiravir, 35 out of 80 patients that received favipiravir showed a better treatment effects in terms of disease progression and viral clearance, with their improvement rate was 91.43%, while in control group there are only 62.22%. And last, a trial was also conducted with 514 patients of COVID-19, in which 257 patients were given Arbidol and 259 patients received lopinavir or ritonavir for the control. And guess, what is the result? Arbidol could reduce the mortality by 77% compared to the control group that only reduced it by 24.7%.
The summary of all the chosen clinical trials showed that among 1,296 patients receiving remdesivir, 802 patients were discharged, which is 62%. 139 patients displayed clinical improvement during the follow-up observation after at least 10 days, which is 10.7%, and 103 patients died, which is 8%.
Thus, the accepted hypothesis will be the alternative hypothesis OHA, in which remdesivir can relieve COVID-19 symptoms or improving clinical condition in more than 50% of COVID-19 patients. Though, if compared to the other drugs, remdesivir has no statistically significant effect in treating COVID-19 patients, though it may be the best COVID-19 treatment at the moment.
So, remdesivir was found to be the most potent antiviral that is currently available, although it does not have a statistically significant effect when compared with the other drug for COVID-19. Several numbers of deaths has also been found during the clinical trial, which may be due to the occurrence of complication and inappropriate drug activity.
What can be improved in the future? First, to improve its efficacy and potency, future development on its specificity and selectivity should be further studied. Second, in clinical settings, therapeutic drug monitoring should be more strictly applied to prevent and reduce the likelihood of death. Third, the development of remdesivir in combination with other antiviral drugs or polypharmacy or with other therapeutic approaches to possibly find a synergistic drug combination and or even develop an effective treatment regimen for COVID-19 patients. Lastly, since trial results suggested that remdesivir alone was not enough to treat COVID-19 patients, finding and developing a new drug that is more potent and effective is also an option for future studies and development.
So, have you get more knowledge about COVID-19 treatment, especially about remdesivir? Moreover, don't forget to always stay healthy, wear your mask, bring your favorite hand sanitizer, and keep your distance. See ya!